So good evening to all, and better if we can start discussing on first the assignment 5. If you guys have any queries on that, so that I can clear on, and then we'll move to the discussion part that is of today's session. So had you went through what is that exactly the assignment 5? Can anyone elaborate on that? Or team leaders, either Khushi or Manchista, they can read on that here itself.
Yes, sir. Sir, should I read it right
Yeah,
now?
yeah.
Or should we wait for 5 minutes?
Let us wait for some more to join in.
Yes, sir.
By the time, if someone is having any of the doubt, please let us know on that.
Sir, in assignment 5, there is written local case study.
That you need to find it out at your
So,
own place. At your own place, you need to find it out as per the SDGs, allotted SDG. What you will do is, as per the alphabetical order, you will allot SDG 1 to 17 first, and
yes,
then
sir.
again the 17th student you will allot SDG 1.
Yes, sir.
So as per the allotted SDG, that is SDG goal, they need to find it out what exactly is there in around their area as a case study and frame it out. It is very well present in our society and very well omnipresent, all these SDGs. Okay, so you
Yes,
need to identify as per the given topic, that is as per the given SDG, what is actually present in your society or in your close vicinity. So find it out, make a case study on that, prepare the challenges for it, prepare the achievements in regard to that, prepare any other stuff which you would like to include on that. Got it?
yes, sir.
So you do one thing, you read on that assignment 5. Let
Yes, sir.
others to join.
Yes, sir. Let's know UN SDGC, SDG goals and tag your local case study by doing a post at LinkedIn. Goal 50 words, purpose 50 words, local case study 120 words, challenge to achieve 75 words, achievement 25 words, way forward 50 words, government program schemes, aligned ministry 50 words, points for evaluation, total 50 marks, writing skill 25 marks, word limit case study, style of writing, use of vocabulary, use of art, video, each carry marks, posting at LinkedIn 5 marks, tagging 20 marks, UPES 5 marks, VC college official 5 marks, ANB learning platform 5 marks, any linked ministry 5 marks, TLs please allot. Okay, sir, this is for us.
Hmm. So any doubt on this? Be specific to the word limit, be specific towards the post which you are going to make. So you have plenty of time. There is 7 days of time I am giving it to you. Uh, Find it out. Kusi, you need to do this allotment of SDGs by today itself.
Yes,
Okay.
sir, we'll do that.
As per the alphabetical order, allot to all. And SDG stands for Sustainable Development Goals. Okay. UN has taken an accord in the year 2015 that let us go for, of course, it was previously MDG, Minimum Development Goals. And in the year 2015, it becomes Sustainable Development Goals. So earlier there were 7 to 8 MDGs, now it is 17. And different indicators have been allotted to each of them to frame it out. Uh, as per your SDGs, allotted SDGs, you need to identify local case study in your area. Write it according to that, write their challenges, write their attributes, write their uh, uh, whatever the achievement they actually did against that particular SDGs, and prepare a post, make it as per the wordings, go as per the given markings, given schedules. Best of luck to all of you. Okay, so any doubt on that, do let me know. So Kushi, are you ready with your presentations, which
Yes,
I have shared it to you?
yes, sir.
Okay. So today what we are going to deliver is, you might be knowing that uh, whenever we are talking about the policy to be framed, uh, there is one organization coming in picture. Whenever we talk about the policy to be implemented or policy to be framed or even the feedback of that particular policy is required to be done, one organization is always coming, and that is called as NITI Aayog. What was the previous name of NITI Aayog? Can anyone tell me?
Sir, Yojana Aayog.
In English it was Planning Commission. Okay. And what is the main uh, task given to any of the Yojana, any year, of course, anytime this Yojana, what they are doing actually? What is their initial work? Once we started, we formed this Yojana Ayog in the year 1951. What was the task given to them? Did anyone know this? What is the main function of Yojana Ayog? That is Niti Ayog nowadays. You know the 5 year planning, 5 year plan, पंचवर्षीय योजना सब लोग जानते हैं? No one is saying, huh?
Yes, sir.
The
Yes, sir.
Panch, the Panchvarti Yojana, 5 year plan for the country and for the states. This has been framed by Yojana Ayog only. That is Niti Ayog. The primary task given to Niti Ayog is this. Although later on some additional work has been given, and policy formulation, policy feedback, and policy implementation too becomes the domain expertise of NITI Aayog, that is earlier the Planning Commission or Yojana Aayog. Okay. So this is of course the organization which is taking care of each and every sector, of course. And today I am going to deliver about a very latest index given by NITI Aayog, that is on health. How best our country is as per the health metrics, or what are those things coming under health actually, under the paradigm of health, how we can analyze any of the state, or what we need to what we all are identifying whenever we are saying that this particular state is at up and this particular state is at down. So what are those indicators, um, or aspects of health which is taken into consideration? So I request Khushi to start, firstly the brief idea, what is the latest status of the states as per the Niti Aayog. Khushi, you can start. Uh, Go to the previous one, not this. We will not start with this. Not this. This one. Okay. So if you go with the data set, and see which state is lying. Actually, this is the top ranking given in the year 2019-20, and you can very well find it out. Kerala is on top, and it was in top in the year 2018 also, 18-19 also, and 2019-20 also. Then comes the second is Andhra Pradesh. Uh, Andhra Pradesh in the 2018-19 also, and in the second position it was Tamil Nadu in 2019-20. Earlier it was Andhra Pradesh. So presently Tamil Nadu is at third, and Telangana is earlier Telangana. Presently the Telangana, previously Tamil Nadu was there. So this get interchanged, of course. Uh, Although the bifurcation has also taken place, so Andhra Pradesh comes to fourth place. Himachal comes on fourth earlier in the year 2018-19. Maharashtra lies at the same place, that is fifth position. this is an overall position for bigger states, of course. Here we have not taken record of the smaller states. And if you go with the top ranking, then you need to go with the bottom ranking also. And you know which state is there for both the places, for both the years 2018-19. UP was the lowest in rank. Bihar was the second state which was lowest in the rank. Likewise, third was the MP, and fourth comes Jharkhand. Alternatively, Rajasthan is also there. Of course, Rajasthan stands bottom in the bottom list of four. That is in the year 2019-20. Earlier, it was Jharkhand. But it's not only that this particular ranking is materialistic, or ranking is saying something that northern part is not working towards health, or southern part is working towards health. Although you can very well make it out how best facilities are there placed in southern part of India to the northern part of India as compared to health index. But performance of states, the latest index states that for the fourth year in a row, Kerala has topped. It's not only that year 2018-19 they have topped. Last 4 years they are on top actually. Uttar Pradesh and come in at the bottom. Tamil Nadu and Telangana are second and third. Mizoram top the health index among smaller states, while Nagaland was ranked the bottommost. Whenever we are taking account of this ranking system in health, this ranking is for three types of states, of course. Top population states, bigger population states, middle and smallest states, and UTs separately. So among union territories, Dadar and Nagar Haveli and Daman Diu was ranked at the top, and Andaman Nicobar was the bottom. Please move to the next. Now, if you see the incremental change, I have given it to you. I have taken a class when we were at NHM during NHM meet with IAS Hiral sir. There I was talking about the incremental. Incremental means adding on to certain things. But this ranking will show you uh, how uh, how the top ranking is going, or how the bottom ranking is going, or how the overall reference ranking of the states are actually fluctuating here and there again and again. Sometimes UP goes to up, here UP goes to bottom. Assam is at second, Assam is at 12th number. So overall reference year 2019 index scores incremental change from base year 2018 to reference year with overall reference year and incremental line. It is stating that this change is actually uh, occurring place if you compare uh, the base year and the reference year. There is an incremental change into that. Okay, so that is what this has been reflected here, that if you compare 2018-19 data to 19-20 data and the compare states to state, the ranking actually is very much, you can see very well this zigzag. This zigzag is because of this only. Okay, the change is there into their overall reference rank also, and the change is also there as per the incremental positions of these states. And this is being sourced by NITI Aayog. Uh, if you go to this, how are the states ranked? Khushi, can you scroll it towards left? Some more. See, whenever we are talking about states to be ranked, okay, uh, the health index is prepared based on the state performance across a large set of indicators and are divided into three broad domains. So what we are doing is we are we are taking into account or taking record of certain indicators. We frame a plan that these will be our indicators, and under the broad domains of the topics, those indicators will be. What are those broad domains? The domains will be health outcome, what is the governance and information model in the state, and what is the key input and the process. So these three will be taking role or taking play. uh, of course, main segmentation is as per the health outcome, as per the governance and information system, as per the key input and process. We are identifying states or we are ranking the states. Health outcome, for instance, include, and now if I am saying that health outcome, it means what actually? Under health outcome, for instance, it includes parameters such as neonatal mortality rate, under 5 years of age mortality rate, and sex ratio at the birth. So here we are talking about uh, prenatal mortality rate, under 5 mortality rate, or even the neonatal mortality rate. Because if you are saying this neonatal or under 5 mortality rate, it is somehow reflecting the status of the state, that how good they are to provide facilities for the infants, of course, the health facilities to those infants, those who are either under 5 years or during pregnancy or during, of course, uh, during birth of a child, how good that particular state is actually, or the infrastructure is, or the uh, doctors are trained, or the nurses are trained, or how the system is working towards that. So it is reflecting those parameters. Next comes the governance model. See, uh, in any of the social development sector, either health or education or water or environment, we keep on talking about certain outcomes. But whenever we are talking about the outcomes, we do talk about the governance model also. Governance model in the sense how best our authorities are equipped in terms of data, equipped in terms of human resource, equipped in terms of infrastructure, equipped in terms of resources, and how best they are utilizing those resources, man to man, how they are using it, how they are effectively using those resources, what all those inputs they are trying to use it as a resource, so that effectively they can actually administer the task which has been given to them. So that is how the governance model, and it includes institutional deliveries, average occupancy of senior officers in key posts, earmark for health. If you take health itself, it's a huge domain actually, a bigger domain. In under health, we are talking about infant health. Under health, we are talking about the health of a lady. Under health, we are talking about health of an old age people. Under health, we are talking more about cancer. We are talking more about deadly diseases. We are talking more about nowadays COVID also. Under health, we are talking about vaccination program, polio program, and so on. So it's not only that only taking care of mortality rate or only giving the pills or the injections will do. There is a complete ecosystem and network which is taken into account whenever we are talking about uh, mm, a ranking of an state. And as per the governance models, uh, this is somewhere uh, those people, those who are earmarked for higher positions or senior positions, how much best they are equipped, and what is the tenure of their, of course, occupancy in that particular post, or how many vacant seats are still left out for those. Because until unless management is not at place, people will not be working. So this is more specifically how best we are utilizing our highly trained officials, highly trained human resource, whenever we are talking about uh, health index, or whenever we are talking about the governance model. Now comes the significance. What is the significance of this ranking? See, whenever we are talking about any of the ranking or any of the index, it means that we are saying that state to states are fighting or unit to unit is fighting for that particular ranking. And what actually this gives a narration of competition among themselves, competition among states, competition among union territories, competition among ministries, competition among hospital to hospital, even competition among doctor to doctor or nurses to nurses. And once this competition is there, the uh, outcome which is to be achieved will be in better form, or the tool can be, this can be a one best tool to make people to work on, to accelerate the pace of any of the health outcome or to achieve any target. So that is why the ranking system or the index, that is health index, is required, and this has been framed by NITI Aayog. It also serves as an instrumental for nudging states, union territories, central ministries to a much greater focus on output and outcome-based measurement and annual performance than is currently the practice. So it means they are targeting towards the output, they are targeting towards the outcome-based performance, they are targeting towards the annual performance among themselves, so that whatever the practice they are following, they are into the practice, or whatever the exercise they are following, they can replicate from other states also, what best practices other states are following, or what can be the one good practice to achieve on that particular set target. So that is why the significance of this health ranking is very much relevant, very much required. With the annual publication of the index and its availability on public domain on a dynamic basis, it is expected to keep every stakeholder alert to achievement of SDG goal number 3. So it means, see, here it comes, Sustainable Development Goals, goal number 3. Uh, I think this is health. This is talking about good and better health for all. And if this index, or if the result of these indexes are there at public domain, and I and you and others, those who are actually eligible or those who can make it out, how the countries or the states are working towards either the health or the education, they can go on, they can read on these reports, they can actually very well find it out what best is in Uttar Pradesh and what best is in Kerala or what best is in Jammu Kashmir or other states, and where we are lacking behind. So this report is actually very much required to read on. Please move to the next. I think this slide is over. Move to the
Yes.
set. Huh. Any questions as if now from anyone? Now, okay, stay here on itself. See, I'm just giving you a reference year here, that is 2017-18, base year 2015-16, and the ranking. If you see the change in base year to the reference year ranking, Kerala remains on top, but for Andhra Pradesh, it is up to 6. It was at 1-8, and it moves to rank second. For Maharashtra, it was 6, it moves to rank third. Gujarat remains same. Punjab, it was second, it goes down. It went to 5, so down 3. Himachal Pradesh 5 and 6, down 1. J&K, it remains same. Karnataka 9 and 8, up 1. Tamil Nadu 3 and 9, down 6 in comparison to base year. Okay. Telangana 10 and 10. If you compare base year, reference year, so up to 2017-18. Okay. This they are actually taking a record of just cross-referring the rank in the year 2015-16 to cross-referring ranking in the year 2017-18. But if you go 2017-18 and 18-19 or 18-19 or 19-20, the rankings are differing. Likewise, Chhattisgarh 11 and 12. Move to the last, next one. Madhya Pradesh 16-17, Odisha 17-18, 18-19, 20-20. This remains at down. and it remains at the same place. Uttar Pradesh, Bihar, 18, 19, 20. Very good states. Close it here. But one thing is there, this data set, the states ranking, the base year to the ranking year, or to the gross base year, or year to year ratio wise, we are taking account of the ranking, gives the idea about that how best or what exactly those states are doing since last 2 years, what these states are doing. And there are certain states which are doing good, and there are certain states which are going down. Uh, Although this is in place and the ranking they can very well see, but still it means functionaries, authorities, the people those who are at sitting at the positions, either they are ineffective, or they are not taking this thing under consideration. That is state health index. Move to the next. uh, mo- Open this one. This all the abbreviations. There is a rationalization. You know what is rationalization? Did anyone tell? Can anyone tell me what is the what this term rationalization means to you? Move to right. Move to left.
Sir, an explanation.
An explanation to with evidence actually. Okay, make it this one. I required this one actually to make you understand. World Bank has actually asked India to go for a rationalization, to prepare a technical uh, rationalization, prepare indicators, chalk out indicators, and then share under the health outcomes, governance, and the process. They asked, even they have asked all the uh, health ministries to work with and uh, align this particular work, align this particular ranking, or align this particular task with an independent agency also. Those who are impaneled through ministries, and these impaneled agencies are visiting to various departments, various infrastructures, and various authorities, visiting, asking them those details by which they are preparing an annual report, by which they are actually doing an annual performance. Previously, we were not having this, and because of that, we were not able to rank the states. And if we are not able to rank the state, how we can build up the infrastructure or the requirements which have been posed to these states, or the opportunities which are likelihood to be in that particular state, that we cannot frame it out, or we cannot actually figure it out to make it happen. Even for this, uh, because India is a large state, and we have a state, India is a large country, and we have a different set of states and a set of population in each of the states. So what they did is they ranked all the states in all the states and UTs in three domains, three specific domains. That is larger states, smaller states, and UTs. So the what is the uh, inventory to be actually taken into consideration? What are all the indicators that is to be taken into considerations are different for larger states and different for smaller states, and even for UTs it is different, because each each specific entities, larger states, smaller states, or UTs, are having a different set of challenge, and are having a different set of course, infrastructure also. Somewhere down the line, UTs are highly equipped because they are small in number, there we can actually create that particular ecosystem or infrastructure. For smaller states also, we are able to do it, but uh, some exceptions are there, because prior to some 10 years or so, we were not focusing more towards the smaller state, that is northeastern states, but nowadays that is also in place. So more specifically, if you if you rank your states as, or if you plan this thing that, okay, let us plan for larger states, this much these many equipments, this much manpower, this much infrastructure, and for smaller states this much, you can do it. And for that reason only, we require these indicators, and we require this particular ranking. If you go in, there were, please zoom it, and I want to actually show. See, there were 5 stages in this. Okay, total there was 5 rounds were there whenever we are doing this, and for each of the round there are the indicators and methodology and categorization of states, and total 24 indicator groups were actually identified in the domain of health outcome, governance, and information. Khushi, can you scroll it to the right? Uh, So, governance and information, key inputs and process. The interactive web portal developed and hosted by NITI Aayog with pre-designed indicators for the health index in the 5th round. Subsequently, data will be verified by an independent validation agency. This got impaneled to the ministry, that is health ministry, and separately they too are doing this. They are computing this index, and of course ministry too is indicating, or they are also in practice of computing it. So with this we get the desired achieved target or achieved outcome, that is health outcome for each of the state. And there will be a split of competence between one state to second state, between one UT to second UT, and there will be a split of competition among uh, smaller states too. And that is why this has been active frame. That was the only aim, to promote a cooperative and competitive spirit among the states and UTs to rapidly bring about transformative actions in achieving the desired health outcomes. Move on to the next. If you see here, 20 states were coming under large states. We have some 8 number of states in smaller, that is Andhra Pradesh, Goa, Manipur, Meghalaya, Mizoram, Nagaland, Sikkim, Tripura. So northeastern states plus Goa and Arunachal Pradesh. Goa only is non eastern state. Rest all are northeast states and UTs. Whatever the UTs are staying. We have Andaman and Nicobar, Chandigarh, Dadra and Nagar Haveli, Delhi, J&K, Ladakh, Lakshadweep, and Puducherry. It means if we are taking or are saying that Ladakh is here as a UT, it is a freshman, that is 2022. Move to the next. Zoom it. What we are doing actually. This data set is saying, this one is saying what we all are actually doing. What we are doing is, we are giving, see, for health outcome for larger states, we have number of indicators for intermediate outcome 7. Okay. For governance and information, health and monitoring data integrity 1 indicator. For governance, we have 4. Health monitoring and data integrity means display of uh, the matrix. For key input and process service delivery, we have 8 indicators, and weight is 20 each. It means 160, 8, 160, 7, 350, 5 each, 1 each, 3 each, 30, 90. 4 is number of indicators 4, weight is 120. Number of indicators 3 for smaller state 90. Number of indicators to 60. How we are getting it? What we are doing is these all are the indicators. Just zoom it. Go up. Health outcome, domain 1, we are talking about key outcome of weight. Larger states 400, smaller states UT nil. What we are taking into account 1.1.1, neonatal mortality NMR, under 5 mortality rate, sex ratio at birth, maternal mortality rate. Under intermediate outcome, what we are doing, modern contraceptive prevalence rate, full immunization coverage, proportion of ANC, antenatal care registered with first trimester against total registrations. For we compare it the first 3 months of registration to the total registration. Move to the go here, this particular area. Scroll down. Okay. Then proportion of for the same indicator, that is health outcome, 1.2.4 is proportion of institutional deliveries. What number of deliveries taken in hospitals, PHC centers, and extra. Total case of notification of tuberculosis. How many TB cases are there? How much TB treatment is going as per the success rate? What is the proportion of people living with HIV and antiretroviral therapy? How many are going with this for HIV and for ART? How many are going for this particular treatment? Then going to domain express, domain 2, that is governance and information. Data integrity measures, institutional revenues, and ANC registered with trimester. Now coming to average occupancy of an officer in months, combined for following 3 posts at state level. How many primary principal secretaries are there? How many mission directors are there? How many director health services are there? How many months of service they are actually into? For last 3 years, how many positions are vacant, or how many in place? This also we are taking into account. Average occupancy of a full-time officer in months, how many months he or she was staying at that particular position in the district in last 3 years. District chief medical officers or equivalent post heading district health services. Number of days taken for transfer of central NHM fund from state treasury to implementing agency. See, the money is coming from government of India. From government of India, the money goes to state treasury, and from state treasury to the that particular implementing agency, that is society, department, hospital, PHC. So how much time it is taking actually? The transfer of that particular money from NHM to the state ministry and to the funding agency and to the implementing agency. How much time it is taking? Proportion of state government health expenditure to total state expenditure. What is the ratio? If we compare the total state expenditure to the state of to the expenditure of health towards health, what is that ratio actually? Coming to domain 3, key inputs and process for large, small, and now this is very, this is what we are talking, how good that ecosystem of a state is working in any of the state or in any of the district or any of the block or village itself. Proportion of shortfall of healthcare providers, regular plus contractual. How many healthcare providers are there in a state? This this is taking count of regular also and contractual also against regular required number of healthcare providers in public health facilities. So they are actually taking a note of how many are required and how many are there actually. So by that you will get the deficiency. Proportion of total staff, regular or contractual, covered under a functional IT enabled integrated human resource management information. Under how many are actually registered as per the IT, as per the human resource management system? How many are registered there? Proportion of specified type of facilities functioning, first referral unit against a population norm. Number of people to number of PHC centers, how many are there? Proportion of public health facilities, Kaya Club score against total number of public health facilities. So in Kaya Club scoring is there for public health facilities in a state. How many are there? Proportion of functional health and wellness centers, how many in state? Proportion of district hospitals with functional critical care units, how many are there? Level of registration of birth, level of registration of death, comprehensive integrated disease surveillance program. How many are reporting as a informed P&L about the data surveillance programs like polio, like TB, like other fungal diseases or infectious diseases or the diseases like malaria or so. So they need to think for, they need to report on that. They need to draw a surveillance program for this. How many are there? Proportion of public health facility with accreditation certificate for quality assurance. How many programs, how many functionaries are actually accredited by standardized quality assurance authorities? Proportion of labor rooms of medical college. How many number of labor rooms are there in medical colleges, district hospitals, sub-district hospitals, CSC center, certified under Lakshya. Under Lux, we are actually giving these numbers. How many child healthcare centers, how many primary healthcare centers, how many district hospitals, how many sub-district hospitals, how many 50-bed hospital, how many 100-bed hospital, how many 200-bed hospital. This is actually written and that, and we are taking account of it. Proportion of maternity in operation theaters of medical colleges, district hospitals. Move to the next. For every 5 lakh of population, we required one FRU. Okay. What NITI Aayog, just go here. This is not required. For preparing this data set, there are key stakeholders. Key stakeholders are NITI Aayog, states, technical assistant agency, and independent validation agency. This TA is actually a type of organizations which are feeding the data actually, who are feeding those data which are present in state. These are independently validating, verifying the data which has been actually given in set of either online form or any display units. States and UTs, the ministries and departments are actually working towards giving the data set to these people, that is technical assistance agencies like World Bank or so many are there. Okay, they keep on coordinating with different districts, mentor different districts, independent validates and agencies. They keep on doing. Comes the NITI Aayog, the role of NITI Aayog. NITI Aayog is reviewing the data, finalizing and disseminating the health index round 5 2020-21 details along with necessary guidance in close partnership of Ministry of Health and Family Welfare. So they are NITI Aayog in sync with MOH, working on it. They also facilitate and interact with states. They also facilitate and interact with uh, technical assistance agency. They also facilitate with independent validation agency. Host a web portal to state and for dissemination of the information, validation of the information, ranking of this information. NITI Aayog is only the host actually partner. These all are supporting to it. They are the host partners. Overall coordination and management. So whatever the data is coming from here, and whatever the validation they are doing, this one, the NITI Aayog is displaying it. So overall, they are coordinating and they are managing this. So that is health index round. Okay. Move to the next. What they are doing? Process flow. In the month of April, May, they are doing this finalization of guidebook of health index. In the month of May, June, they are submitting data on portal. In the month of June, July, they are validating it. In the month of August, they are actually they did indexing on ranking on this, and report dissemination of ranks August September they have displaced. Move to the next. Here, come here. Not required. Move to the next. This is huh. mm, the base year, reference year for each whatever we have actually discussed in the previous slide. They are giving writing it here, reference year, base year, numerator, denominator, data source, remarks for each of that. That is why proportion of ANC registered, proportion of pregnant women who received 4 or more ANCs, proportion of institutional deliveries, full immunization coverage, modern contraceptive prevalence rate, maternity mortality rate. This data is actually they are getting it and feeding it in that particular data web or data portal. Please move to the next. Move to next. Governance model. Likewise, they are putting it in that. Move to the next. Input resources. This we have discussed. Move to next. Move to next. Move to next. Okay. Move to next. It's been done. Okay. So we got what exactly they are doing it here. Now open that first PDF health tracking. There is one link given there. Open that particular link. Kushi, are you there?
Yes, I'm opening the link.
Open that link. That is of NITI Aayog actually. Open it. If you go and Google it, or if you go to this particular link, can you zoom it? Wait. You will get for each state the health index. What is the incremental progress on that, and what is the incremental rank into this? Just click this one, Khushi. This one first. Overall performance health index. Okay, this is giving a report that which state actually rises up as per the ranking and which is going down. So top marking arrow is showing that it is increasing as per the ranking, and bottom is showing that this is going down. Uh, Go to this custom ranking. Select any of the state and select any of the indicator. Go to Uttar Pradesh. Select one more. Compare it with Uttarakhand. Compare ranking. Select two states here actually. Which state we have? Uh, this is as per the Kerala, we got 72.49 for neonatal, and others are following that. This is on top. If go click on the figure, click on this figure. See, as per the figure wise, Kerala is here, 72.49. Where is Uttar Pradesh? Half of it. Not even half. 70, 39, I think. 35. This one is how much? 30?
39.59.
39. Okay. Slighter, slightly higher than 50% of it. So see where we are and where they are, and they are small. Of course, the number state is this state is huge, this state is small. The comparison wise, population wise, demography wise, of course, but something is to be learned on from these states. Himachal Pradesh, see, it's a very small state. So smaller are getting more facility in terms of health, or even management is also thinking for that. Let us target the smaller first, smaller more, and let us uh, uh, try to escalate slowly for our bigger states too. So it is like such, I feel. uh, Kusi, move to last. Okay, you can close. Let me share, then I can actually do it from here my end. Are you able to see my screen? Is my screen visible to you all?
Yes, sir.
Okay. Let us this is the same. Front runners index is higher than 62. Achievers index is between 48 to 62. Aspirants index is less than 48. So uh, we are giving status to each state. That one state is coming under this thing. What you call as an aspirant, top runner, that is front runner, having index more than 62 is front runner. Achievers between 48 to 62, and aspirant those who are less than 48. Okay. Okay. What we do is, there were five. You can see this board now. That is round one, round two, round three, round four, round five. Can you see on the board this one on the
Yes,
display?
yes, sir.
So what NITI Aayog and Ministry of Health is doing, there are 5 rounds into this, and for each round, uh, the team is working to get the data. Although the data is same, but every time we are taking this data, that is for 3 months first, then second 3 months, then third 3 months, and fourth, and then finalizing on the round 5. What we are trying to do is here, we are trying to find the outcome on neonatal mortality rate, under 5 mortality rate, sex ratio at SRB, maternal mortality rate under this. Then comes intermediate outcome where we are talking about MCPR, full immunization, proportion of infant 9 to 11 months old who have been received BCG. Even what is the timeline for that activity, that also we are referring. The percentage of women of reproductive age who are using a modern contraceptive method at a specific point in time. Proportion of infant between 9 to 11 months who have received BCG injections, DPT, oral polio, vaccines. Proportion of pregnant women registered ANC within 12 years during specific time period, that is specific year. So for each of the thing, we are actually giving a timeline also. And for each of the timeline, we are taking a data. Proportion of new and previously treated TB cases notified against the target of TB cases to be notified during specific year. Every year we are going with a target number of TB cases to be taken care of. And how many we are actually doing, how many of the those uh, cases we are actually registering or notifying, then how many cases we are actually going for a treatment, proportion of TB notified with successful treatment outcome against TB cases wise notified in a year prior to the specific year. So how many are successful under that? Even for health monitoring system, percentage of deviation of reported HMIS data from NFS. Suppose I'm saying that 10 number of people are registered here. So if I take an error of 1%, that is one will not be there. So how much deviation is there as per the data? Average occupancy of an officer for last 3 years. Average occupancy of full-time CMO in months in all the districts in 3 years. That is state, and as per the state report we are doing, time taken in number of days by state treasury to transfer under central NHM finance data. Who is giving what? Even we can see here. State report is given, state report is given for this. NHM is giving the finance data to this for this actually. How many time it took, number of days it took to transfer the money to the implementing. RBI is giving this report, proportion of state government health expenditure to total state expenditure, because RBI got this particular data actually. State report about auxiliary nurses, midwives, staff nurse, medical officers, specialists at district hospitals, specialists like surgeon, gynecologist, pediatrician, anesthesia, ophthalmology, orthopedics, radiology, pathology, ENT, dental, psychiatry, lab technician. State is giving the report and that is being finalized, and that data is being entered in the data. And based on that data, we are actually getting this particular ranking. Proportion of staff for whom payslip is given or posting is being generated. State report, the independent validation agency State report, the independent validation agency will verify the following: ascertain the functioning of IT enabled, facility wise generation of line listing of HR, that is regular and contractual payslip. They are seeing that whether the organization, whether the particular department is IT enabled or not. HR, those HR laws, HR provisions is in place as per the IT requirements or not. Proportion of public sector health facility conducts specific number of 3 sections for FRUs. First referral unit, how many are there? For 5 lakh of people, at least we required one FRU. So how many FRU are placed in a state? State is giving a state is actually giving this particular report. Likewise, proportion of sub centers, primary health centers, Ministry of Health and Family Welfare, they are giving this data pre-entered. State report of MOH, civil registration as CRS system is giving uh, uh, the birth registration and the death registration in any of the this thing what you call state, town, village, likewise. So taking account of each and everything about a district hospital, sub district hospital, CHC, PSC, UPSC. So by that, uh, proportion of labor room, how many labor rooms are there? Proportion of maternity OTs, how many are there? And then we get the data set. And based on this data set, after getting the data from different ministries, different uh, uh, departments, and third party is validating that particular data, and then we get the report. That report which you came to see, that who is what, that is in terms of index. If you go to NITI Aayog and you can get for so many things, water, school education and all. Here we are focusing, today we are discussing more on this. That is why you can get in terms of figures, that is Haryana 2015-16 versus 2014-15. Okay, this, that is Haryana was on top, 6.49. Okay, I'm trying to get who all are front runners: Kerala, Andhra Pradesh, Maharashtra, Gujarat, Punjab, Himachal, Jammu Kashmir. These all are front runners. Achievers: Karnataka, Tamil Nadu, Telangana, Haryana, Chhattisgarh, Jharkhand, Assam. And at the bottom is Uttar Pradesh, Bihar, Odisha, MP, Uttarakhand, Rajasthan. So why the bottom? Because we are having this index score less than 48. If you see this blue mark, front runners are these, achievers are these, achievers are these, and aspirants are this. So you can find it out. Whenever we are taking into account 60%, 69.44% is of, we are talking about health outcome, 18.52% we are talking about key inputs and process, and 12% we are talking about governance and information. So again, governance and information is even lesser than the key inputs and the process. This can be one of the question. Okay, and this, on what basis this front runner, achiever or aspirants are given? Custom ranking. Okay, now let us see. Select one more generate ranking. Okay, I'm trying for Assam and Bihar. It's not happening. Bihar, Assam. This we got. Okay. For, if we take two states, Assam and Bihar, new mortality rate it is 1. It is second. Under 5 mortality rate it is 1. It is second. Actual value 5243. This is in the year of, for round 1. हाँ, actual rank 23rd, actual rank 27. Assam 52, 43, 2.30, 3.30, total fertility rate. Proportion of low birth 14.43, 9.23. Sex ratio at birth 896, 908. Bihar is higher in sex ratio. Full immunization coverage, again Bihar is higher, 89.74, 83.34. Proportion of institutional leavers, Assam is higher. Total case notification rate of TB 119, Assam is higher. Proportion of people living with HIV, Assam is higher. The answer is Bihar. Data integrity measure, institutional levels ANC registered with first trimester 2.72, 17. Good. Bihar is higher. So average occupancy of an officer 221. So whatever is completion of IDSP, proportion of district with functional cardiac care, zero. Assam we have zero actually, and this is why states like Assam are facing cases. So and even Bihar is having very low number 5.26, but it is there. Here also it is zero. Standard quality assurance programs, they don't have NQAS accreditation. So if they don't have an accreditation, it means they don't have an infrastructure likewise. That is why this accreditation is not there. Might be the facilities are there, but they are not as per the standards. So likewise, one can compare two states also in this. In figures also you can compare Assam, Bihar for each thing, each of the thing. Okay. So this gives incremental performance. We got it. We got this one. Indicator wise performance. If you compare baseline, compare baseline. Okay, only for 14, 15, 15, 16. Up to here, the data is there. Green is incremental change, positive. Negative is red is incremental change, negative. Okay. So with this, likewise, if you go to NITI Aayog website, you will get health, you will get for water, you will get for school also. So not taking much of the time, let us close here. How to close? Okay, so we are end up for our today's presentation. If any questions are there with you regarding health index or regarding any of the indicator, do let me know that we can discuss on, and request all to switch on your videos so that we can have pick for the day, and do prepare yourself for your assignment 5. Request all to switch on your videos. Team leaders, if you need to say something, please let us know. Manchista or Khushi, do you have anything to share? Any doubts with you? And up to when your this test is going on? Up to 14th, I feel.
Sir, only till 12th.
Only till 12th. Okay.
And Abhinav will get a leave on 14th.
14th. Okay. So accordingly, we will plan. Okay.
Yes.
Rest. Take care. Enjoy yourself. Okay. And stay at home. Thank you.
Thank you, sir.